Alright, let's start with a question. What if I told you that one of the most popular pieces of fitness advice out there, Kegels, is actually causing more harm than good for a lot of people? Yeah, I know. You've heard it your whole life. Do your Kegels. Strengthen that pelvic floor. But here's the thing, nobody's talking about the other half of the equation. And that's exactly why today's topic is blowing my mind. Reverse Kegels. Not just a gimmick, not just a trend. This is something pelvic floor therapists are quietly screaming about. Let's unpack why. Okay, first I need to get this out of the way. I'm not a medical professional, but I've been diving deep into this stuff, and here's what I'm realizing. Your pelvic floor isn't just about squeezing. It's about balance. Think of it like a bicep curl. You don't just flex your bicep and hold it there forever, right? You lower it, you relax, you repeat. So why do we treat pelvic floor muscles like they only need to tighten? That's the disconnect here. Over-tightening? It's like walking around with clenched fists 24/7. At some point, your hand's gonna cramp. Your pelvic floor? Same idea. Now, here's where it gets personal for me. I remember a few years back, I had this friend who swore by Kegels. She'd do them religiously while driving, during meetings, you name it. Then she started having pain. Actual pain. Went to a specialist, and guess what? Her pelvic floor was locked up tighter than a vault. She needed reverse Kegels to even function normally. And that's when it hit me. We're taught to strengthen without ever learning how to release. Isn't that wild? Like telling someone to lift weights but never lower them. Something's gotta give. So what's a reverse Kegel exactly? Simple. Instead of tightening your pelvic floor muscles, you're lengthening them. Imagine pushing out slightly, like you're trying to relax the area instead of clenching. Sounds basic, right? But here's the kicker. Most people can't even feel those muscles properly to begin with. And that's the problem. If you're only going one direction, squeeze, 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 you're building a muscle imbalance. And imbalances? They lead to issues. Pain, dysfunction, even incontinence. Which, ironically, is the exact thing traditional Kegels are supposed to prevent. So in trying to fix one problem, you could be creating another. What's fascinating to me is how this ties into a bigger pattern in fitness culture. We're obsessed with activating, engaging, squeezing. But what about recovery? What about control? Think about core training. You don't just do crunches and call it a day. You stretch, you breathe, you balance flexion with extension. The pelvic floor's no different. But somehow nobody's teaching that. And I wonder why. Is it because Kegels are easy to explain? Or is there a deeper stigma around pelvic health that makes people avoid discussing the nuance? Because let's be real, pelvic floor therapy isn't exactly dinner table conversation. But maybe it should be. Here's another angle. Why do you think pelvic floor therapists are the ones pushing this? Because they're seeing the fallout. They're the ones cleaning up the mess after people overdo it. And let's be honest, most of us learn Kegels from a 30-second TikTok, not a specialist. So we're doing them wrong. I've definitely done them wrong. And if you're someone who's been religiously squeezing and wondering why you're still having issues, this might be your wake-up call. It's not just about strength. It's about coordination. Your body needs to know how to both contract and relax. Otherwise, you're just creating tension where there shouldn't be any. So what's the takeaway here? For me, it's this. The human body is all about balance. And the more I dig into topics like this, the more I see how oversimplified fitness advice can be. We take these bite-sized tips, do Kegels, stretch daily, and apply them without context. But context is everything. Your pelvic floor isn't a dumbbell. It's a complex system of muscles, nerves, and connective tissue that needs both strength and flexibility. So maybe it's time we stop treating it like a one-trick pony. Maybe it's time we start asking, what are we not being taught? And more importantly, why? What do you think? Have you ever tried reverse Kegels? Or did you not even know they were a thing? Drop a comment below. Let's turn this into a conversation. Because if nothing else, this topic has taught me one thing. Sometimes, the opposite of what you're told is the real answer.